I'm Dr. Goldman, pediatrician. Today we will be talking about diarrhea. Diarrhea, you know, of course, is when poo-poo is abnormally soft. Diarrhea is actually a complicated topic, but also an important one, since it affects so many kids all over the world. It is important because it causes so many hospital admissions, and yes, unfortunately, so many deaths around the world too. Consequently, I did procrastinate for a very long time before making this video actually. You see, I had to produce something practical yet not too long, and okay, it's actually very long, while warning incessantly along the way that diarrhea was a dangerous beast. By the way, already a word of warning before we start. If your child is sick now and less active and unwilling to drink or eat, it is probably the time to see the doctor quickly and watch this video later. Also, I certainly invite you to look at the different chapters in the description below, so that you can go straight to the part that interests you most. So let us start. Okay, as parents, the important bit of information is what to do practically when your child has plenty of liquid stools and looks sick, and we will talk about it in detail, of course. But beyond that, it is also useful to understand the issues surrounding an episode of diarrhea, like, for example, to know how to prevent diarrhea from occurring as much as possible, of course. Then to recognize also when stools are abnormally soft, which means also understanding what is a rather normal poo-poo. We also need to know what to do to avoid that the situation gets worse. That is, what doesn't work and what may make the matter worse. And of course, we need to learn when is the time to see the doctor, and when, on the other hand, you can wait while doing the right thing at home. And so we will cover the following important information here. That is, define diarrhea, state its common causes, including some dangerous situations often associated with diarrhea. We will explain also the signs appearing in more severe diarrhea. We will then, of course, talk about the treatment of diarrhea. Of course, that's a core element in this video, and what can be done, of course, at home to avoid having to see the doctor, if that is possible, of course. Notably about how to decrease the chance of dehydration and electrolyte disturbances, that is, having too few water in the body along with abnormal blood acidity, which is actually the main risk of diarrhea. We will also explain how to best prevent diarrhea when possible again, and briefly mention particular situations of diarrheas in areas of the world where the illness may be more severe and where some specific treatment may be necessary. I have recently made a video about liquid stools in breastfed babies. I explained there that liquid stools are normal when babies are breastfed, and by the way, we will mention later in this video breastfeeding as one way to help protect babies against diarrhea. But today we will talk about abnormal liquid stools, which means when stools are abnormally soft and frequent because of an illness. There are in fact definitions about what counts as a diarrhea, but we can already see that in the case of healthy breastfed children, that these definitions are not absolutely reliable. Now, we consider the diagnosis of diarrhea when there are more than 3 loose or watery stools per day. But more usefully, we should strongly suspect diarrhea when there is a clear change from what is usual for the child, often then with the child appearing ill, and sometimes with the appearance of mucus and blood in the stools. You will often find the word gastroenteritis when specialists refer to diarrhea. It's a fancy way to say an infection of the digestive tract. We will talk here about acute gastroenteritis that is typically accompanied by the sudden onset of diarrhea, and that has by definition a duration of less than 14 days. Longer duration than 14 days somewhat arbitrarily is referred to as chronic diarrhea. We will not discuss the issue of chronic diarrhea today. Now, diarrhea is caused by a very long list of possible problems, although most diarrhea are infectious, and most infections are actually caused by viruses. In the group of viral diarrheas, rotavirus and norovirus make up the highest share of the total. but a series of other viruses can also cause diarrhea. Sometimes diarrhea can be the manifestation of a more serious disease, beside the potential for dehydration by diarrhea itself. In such case, other signs of illness will also be present on top of diarrhea, and diarrhea may even not be the main sign of the illness. I mentioned some of those important diseases here, so that we keep them in mind when facing a diarrhea. For example, there is the gastroenteritis caused by a bacteria called Salmonella, and in which we often see mucus and blood in the stool, but where the bacteria Salmonella can actually reach the blood, causing then fever and a generalized infection. There is also an illness caused by the bacteria Staphylococcus and responsible for the staphylococcic toxic shock syndrome, and which may present with diarrhea initially. You may also have heard about a surgical condition called intussusception, in which one part of the gut slides into the other, and that may also be accompanied by an often then bloody diarrhea. Then everyone knows, of course, also the common appendicitis, which is in some circumstances, like in younger children, can present with diarrhea. But of course, the treatment of appendicitis is surgical, which is very different from the typical treatment of a gastroenteritis, which will focus on rehydration. Some toxins produced by the bacteria Escherichia coli are responsible for an illness in which diarrhea is followed by an anemia, that means when there is not enough red blood cells, and a kidney failure. And this is called the hemolytic uremic syndrome. Now we will end this list by some weird yet real situation whereby some common childhood infection may sometimes present as diarrhea in young children. This is the case, for example, for urinary infection and the middle ear infection. Of course, this is not to say that such presentation is the rule, but it may happen, and so we should think about it. The list here, of course, is not complete, but it was to show you that diarrhea can be caused by a variety of agents and also lead to more than dehydration, requiring then sometimes specific and urgent diagnostic procedures and surgical or medical treatment. Sometimes, as mentioned, in front of a child with diarrhea, we should think about a diagnosis that is remote from the diarrhea itself, like, as I said, urinary infection or an ear infection. Of course, the purpose of this video is not to replace the doctor, who is in charge of making diagnosis and treatment, but rather to raise a level of awareness about the variety of possible causes and therefore the possibility that something more complicated is going on. All right, I have mentioned before that acute diarrhea is usually the consequence of an infection and that it lasts less than 14 days. In which case we would call it an acute gastroenteritis. I have also said that most often these gastroenteritis are caused by a variety of viruses, notably the rotavirus and norovirus. These viruses would also quite typically lead to a watery diarrhea, which means that we don't often see blood or mucus in the stool in case of a viral infection. And so the presence of blood or mucus should alert us to the possibility of a bacterial infection, or in some area of the world of an infection caused by a parasite called amoeba. Or even, as I have mentioned before, let us suspect that one of these more serious illnesses also associated with diarrhea, like intussusception, for example, is at play. Note also that all these agents, that is viruses, bacteria and parasites, can be responsible for the presence of fever. So it is safe to assume that if we see the sudden onset of a watery diarrhea, that is without visible blood or mucus, we are most probably dealing with a viral illness, the most frequent agent causing gastroenteritis. On the other hand, if we do see blood or mucus in the stools, we should suspect something more complicated and potentially serious, and therefore we should consult a doctor without delay. By the way, it is a good idea to not start using antibiotics by ourselves when we see blood in the stools, or of course when we face a watery diarrhea. Some bacterial gastroenteritis, like the one caused by Shigella, for example, or sometimes Salmonella, may require antibiotic treatment. But in many instances, antibiotic will not be helpful and can sometimes be downright harmful and facilitate the development of more serious conditions like the hemolytic uremic syndromes that I have mentioned before, or even create the right environment in the gut for some other really problematic bacterial illnesses like the one caused by C. difficile, for example. Having started antibiotic before being able to make a culture of the stool will also likely hamper the discovery of the causal bacterial agent of the infection and then leave us without a clear diagnosis. So again, don't start antibiotic by yourself when your child presents with diarrhea, and do seek the doctor's opinion to make a proper diagnosis, which will then decide which treatment, including possibly antibiotic, is necessary. In general, again, the presence of blood or mucus in the stools should lead to a visit to the doctor, because such situation is likely to be more serious and may require evaluation like stool cultures, possible antibiotic treatment, or even, as mentioned before, some urgent surgical procedures. Now, the really important thing about diarrhea, especially in fact those sudden very watery diarrhea, so actually most probably a viral diarrhea, is that it can easily lead to dehydration. This, I should remind here, can happen in a matter of hours in an infant. Saying dehydration is in fact just a fancier way of saying that our body doesn't contain enough water to function correctly, leading then to a series of problems if nothing is done to correct it. On top of it, diarrhea often leads to imbalance in electrolytes in the blood. We are, for example, talking here about sodium, potassium, and the acidity, or that is the pH of the blood. In gastroenteritis, the electrolyte imbalance will tend to be an excess of sodium concentration and a decreased potassium concentration in the blood, along with abnormal acidity as dehydration progresses. But this is highly variable depending on what the child has been drinking in the process. The point is, diarrhea and dehydration lead to electrolyte disturbances, and the balance of these electrolytes in the blood along with enough body water level are essential for the proper functioning of our body. And so the challenge of diarrhea is really to prevent dehydration and electrolyte imbalance from happening, and then to correct these problems when they have already happened, while at the same time, of course, maintaining a proper intake as the diarrhea, which means ongoing losses, continues. This is the principle of treatment in case of diarrhea, that is, to administer water and electrolytes. Now, you have probably heard about the methods to give water and electrolytes. It can be done by the vein at the hospital, of course, but it can also be done orally, which importantly can be achieved at home. In fact, as much as possible, it is recommended to use the oral rehydration method. And that is because beyond the fact that it is cheap, easy and painless, it is also safer in terms of correction of the electrolyte imbalances, because it is done through the gut. Of course, this method has also its limits. If a child indeed is too weak to drink, well, there isn't much choice left, and intravenous rehydration should be carried out in the hospital. In such case, the risk of a dangerously low level of hydration leading then to shock and organ failure demands a more intensive surveillance and aggressive management in a hospital setting. Sometimes also the diarrhea is so important, especially in smaller kids, that it becomes difficult to compensate adequately for the losses at home in a home setting. But again, oral rehydration has been recognized for many years for its safety and effectiveness in most situations. That is, excepted in case of severe dehydration, of course, as mentioned before. By the way, there is a worldwide officially recognized way to gauge the level of dehydration that doctors can use to assess severity. For parents, practically the easiest way to judge of an increasing severity is by observing a decreasing activity level, the presence of irritability in their child, listlessness, and of course a major thirst. At that stage, we are probably already in the moderate dehydration stage, and it is then definitely the time to think about seeing the doctor before things turn for a worse. It is sometimes very challenging indeed, but by knowing what you can already do at home, which is one of the goals of this video, you will give yourself the best chances to avoid having to go to the hospital. Now, how should we proceed when we discover that our child has abnormally soft or liquid, abundant and frequent stools? Well, the first issue is to find out from the start the chance to still end up seeing the doctor no matter what. If your child is very young or acting sick, less and less active and worsening quickly, or if the diarrhea is very abundant and frequent from the start, or that we have a combination of these situations, then you know that you should quickly seek the help of a professional. Fortunately, this is not the most frequent situation, and often there is time to do something at home that will already help, and that's one of the goals of this video. Also, precisely what to do and what not to do. The one thing that many people do during a diarrhea, unfortunately, is to virtually stop giving food. That is actually a very bad idea, and so do not stop giving food, even if you have the impression that there are more stools as a consequence. Instead, give food more frequently than usual, as your child is likely then to be only able to eat a few at a time because he's sick. Food rich in water, not dry, that is a soft puree for example, is probably the best choice in such case, if your child has already started solid food of course. And then certainly breast milk and formula should also be continued. And formula, by the way, should not be diluted. But meals should be offered more often than usual to ensure a steady intake at a time when important losses, you remember, are likely to happen. So yes, as normal feeding as possible should be actively promoted, and we should avoid feeding kids with only bland soup or white rice. Indeed, it is not unusual to see kids on a bland, unbalanced diet during a diarrheal illness. Kids who then have a prolonged diarrhea as a result of malnutrition, phenomenon sometimes called starvation stools. So, I hope it is clear, kids should be fed as normally as possible during a gastroenteritis, usually by offering frequently small quantity of food at a time. Now, food alone and the water food naturally contains is unlikely to be enough in a case of diarrhea. Naturally, kids will be thirsty and request water, which then they should be offered, of course, as frequently as they wanted, and be also encouraged to drink. Now, smaller kids, however, should even be more actively proposed to drink water on top of their usual diet, as they are, of course, less able to make themselves understood and may also dehydrate faster. In mild cases, food and some extra water might be all that is necessary to go through the illness. Alternatively, half-strength apple juice may also be a reasonable choice. Again, in case of light diarrhea and with no obvious dehydration, so that is basically with a child otherwise acting and looking completely normally. Ideally, however, when there is a frank diarrhea, we should use a special solution made of oral rehydration salt, also known as ORS. This is often referred to as WHO oral rehydration salt, and it is actually a mix of the sugar, glucose, sodium, potassium and bicarbonate, or often nowadays citrate, that are all carefully dosed together to ensure the best absorption of water, glucose, sodium and potassium in the context of diarrhea. Several commercial formulations exist for that, with slightly different dosing of electrolytes and glucose, but still good at ensuring rehydration and with a balanced electrolyte mix. Now, I really insist on that because you will hear many different recipes of so-called rehydration therapies, like for example chicken broth, sports drink, tea or cola. The list goes on. These, however, are not appropriate for rehydration, contrary to popular beliefs, because they don't contain the right mix of sugar and electrolytes. In particular, they either contain too much sugar, for example the cola or sports drink, or no sugar at all, like tea and chicken soup, and their electrolyte level is negligible, except in the case of chicken broth, which contains far too much sodium. On top of that, these drinks' concentration in dissolved substances tend to retain more water in the gut, having then a kind of laxative effect due to the excessive amount of sugar or sodium they contain. Of course, that's not what we hope in case of diarrhea. So, for rehydration, one should use the WHO Oral Rehydration Solution or one of the similar commercial solutions available, and not these commonly available beverages that are not intended for rehydration in context of diarrhea. Yeah, I'm sure it is clearer now. Finally, regarding rehydration solution, it is also recommended not to mix yourself the individual rehydration salts at home, the glucose, the potassium, sodium, as it is well known to be associated with errors in the dosing, which can then have serious consequences. So do ask your pharmacist or your doctor about the right ORS available nearby, and read carefully the instruction about how much water needs to be added to the ORS powder. Okay, so much for the type of ORS or oral rehydration solution to use. Now, what about the quantity of solution to give? This actually depends on two things that are actually easy to understand. First, it is about how much has been lost so far, and then how much is still being lost at the moment. That much, that is, past and ongoing losses, need then to be compensated. In a hospital environment, we calculate these things as precisely as possible. But that is not very practical or even necessary at home. So, how to account for what is already lost and what is being lost? Okay, let us first look at what has been lost already. We can estimate the likelihood that any significant amount has been lost by using the symptoms of the child that we have mentioned already before: listlessness, irritability, and an increased thirst, of course. When these signs appear, we likely enter already the moderate dehydration stage, which also signs a net loss of fluid from the body. This quantity lost from the body's normal fluid level should be replaced as soon as possible. That is, in a few hours, for example 3 or 4 hours, and we will know that we do well by having a child who gets then less irritable, less thirsty, more active, and also who starts to urinate as frequently or even more frequently than usual. If, on the contrary, and despite your efforts, your child is then getting worse, you should then seek a medical help quickly, because it means that your child is getting worse towards a more severe dehydration and will most likely have to be observed and treated at the hospital. Now, if your child is indeed very thirsty and irritable, what is the amount of ORS that you should offer your child? In such setting, we can consider the amount lost and needing rapid compensation to be around 50 to 100 milliliters for every kilogram of body weight. Now, let's take as an example a 10 kilogram child. That would amount to around 500 milliliters to 1 liter of estimated water loss, and that should therefore be compensated with oral rehydration solution in a few hours, say around 4 hours. 1 liter actually corresponds to around 4 typical water glasses or 4 standard baby bottles, so between 200 and 250 milliliter in each bottle or glass. And so for our 10 kilogram child with something between 500 milliliters and to 1 liter of water loss, it would amount to 1 such glass or bottle every hour for about 4 hours. That is not an enormous amount, but it may take a while because the child is sick and may be able to take only a small quantity at a time. It means also that we should use every opportunity during these 4 hours to have the child drink. In practice, we should often, sometimes very often, offer to drink a few sips, and that is to ensure that the child will have been able to drink all the estimated losses in the 4 hours we have given ourselves to compensate for the loss. All right, we have covered the first point, that is to recover the past losses quickly. Now, during that time and after this quick initial rehydration, it is also likely that our child will continue to produce some diarrhea, possibly for several days in fact. If that is the case, water lost in stools should also be compensated as it happens, in order of course to avoid recreating a water loss. So, how to compensate now for what is currently being lost? In other words, how to maintain the current level of hydration in spite of ongoing losses. In fact, we use the same oral rehydration solution for maintaining hydration level. This time, the quantity given is estimated from the quantity of water lost in every stool, and the oral rehydration solution is given after every diarrheal stool. The quantity recommended depends on the age of the child and is estimated to be roughly 10 milliliters of solution per kilogram of weight after every abnormal stool. For example, it would mean around 100 milliliters for a 10 kilogram child and 200 milliliters for a 20 kilogram child after every abnormal stool, that is. An equivalent estimation is to count 50 to 100 milliliters of solution for a child up to 1 year and 100 to 200 milliliters for a child between 1 and 2 years. This last calculation is actually easy to evaluate when we don't have a clear idea of the current weight of the child. We just have to remember the amount under 1 year and between 1 and 2 years of age. As you can see, these are approximate numbers, and it is okay because our initial evaluation is also approximate. But we do know it works because it has been used and evaluated for many years. This method, along with the method to evaluate the level of dehydration, is actually recommended by the World Health Organization, the WHO. So, in practice, and as part of our example, if our child, a 10 kilogram child, found dehydrated before, had now 2 diarrheal stools during the time of his quick initial rehydration, then during these 4 hours rehydration, this 10 kilogram child with 2 diarrheal stools should be offered about 50 to 100 milliliters for every stool. And since she had 2 abnormal stools during that 4-hour period, she should then be offered between 100 and 200 milliliters of ORS for these ongoing losses. Now, the total amount of solution during these 4 hours of initial rapid rehydration should be between 500 milliliters to 1 liter plus 100 to 200 milliliters, that is a total of 600 to 1,200 milliliters of ORS solution. Now, once the initial rehydration period is finished and the child is less thirsty, less irritable and pees more, we only need to continue with the maintenance phase compensation, which is done whenever there is a diarrheal stool, of course, and until the end of diarrhea. Finally, remember that your child should continue to eat as normally as possible, which may be difficult, as you know, because the illness means also less appetite and often, unfortunately, vomiting. By the way, have a look at my video on vomiting for that part. And so make sure that you also apply the frequent feeding method for food and milk. Now, it may be that your child doesn't want to drink the oral rehydration solution. That's actually quite frequent. It is important to try, however, and often propose the ORS solution. And that is even if your child only drinks a few sips at a time, because these are actually sips of ORS and valuable few sips. It may add up to a significant amount in the end. So that is worthwhile. Then, if your child really doesn't want to hear or to drink any of it, then don't get into a battle with her. Instead, continue trying frequently and also try water or, as suggested before, half-strength apple juice. Since we don't know for sure the level of dehydration, we also can't assess very precisely the need for rehydration solution. So the best we can do is actually to try and try often. This being said, we should always remember that if our child is less and less active and getting worse instead of getting better, then we should, as you know, seek the help of a doctor because intravenous rehydration or other treatment may be warranted. Now, the diarrhea itself, as I have mentioned previously, could well last for a few days with increasing intensity at the beginning, a plateau then, and then a progressive improvement. Different viruses would lead also to slightly different courses, but for sure, by 14 days, things should have should be back to normal. Otherwise, again, we should try to understand why it is not the case and why the diarrhea continues, and then seek a medical opinion. Actually, most diarrhea episodes are due to viruses, as you know by now. And these diarrhea are typically self-limiting, which means that they end by themselves without the need for specific treatment, beyond, of course, the continued feeding and rehydration therapy that we have already described. Often, however, I see that children are given a series of medicine in case of what is most likely a viral diarrhea. So, what about these other possible treatments? Drugs. Drugs like anti-vomiting, anti-motility agent or montmorillonide, better known as Smecta, are actually not recommended for this common infectious diarrhea. I have already mentioned the question of antibiotic and explained why we should not start antibiotic on a child with diarrhea, unless, that is, we know that it is useful and safe to do so, which is usually then decided by the doctor on the basis of the germ we know is involved. Remember that in certain cases, antibiotics can lead to a more complicated or even dangerous situation. Probiotics. Probiotics, that is, as you probably know, live bacteria, have been used in the past few years to help reduce the amount of diarrheal stool. It seems, however, that if probiotics have any benefit, it should only be a modest one. Then you may have heard about zinc as a way to decrease the severity of diarrhea. And zinc is actually a recognized part of the treatment of diarrhea of children at risk or in a situation of malnutrition. And that is a situation, unfortunately, still frequent around the world. But zinc is not recommended routinely for diarrhea in kids who are well nourished, which is usually the case in big cities around the world, where kids have access to a sufficient variety and quantity of food. Now, in resource-limited settings where zinc would be recommended, this element would be part of the routine management of diarrhea and would therefore be routinely prescribed by doctors. In the same way, vitamin A supplements would also be recommended in those areas at risk for childhood malnutrition, but again, not routinely in affluent setting. You can see, by the way, that in resource-limited settings, the treatment of diarrhea is slightly different, or rather that it includes a few other elements. But the basic principle of rehydrating and maintaining hydration as much as possible by using oral rehydration solution still applies. In such resource-limited settings, there are two important factors to consider. There is first the risk of malnutrition and then the access to clean water and food. These two factors contribute to more frequent, more severe diarrhea, and also to diarrhea from actually a greater variety of agents on top of the common viruses, including a greater risk of bacterial but also parasitic illnesses. All right, to conclude now, I want to review the important topic of trying to prevent diarrhea. None of these methods is actually 100% effective alone, but together they significantly reduce the risk of catching the illness. So, what are these prevention methods? First, you will probably know that there is a safe and effective vaccine against one of the most common viruses around, the rotavirus. This vaccine is now offered in many countries and has been associated with a sharp decrease in the incidence of rotavirus diarrhea admission to the hospital. That was actually a very frequent cause of admission when I was a medical student here in Belgium, and now because of the vaccine it has virtually disappeared, at least from the hospital. Rotavirus is a universal scourge, but it is even more severe for those kids who are not breastfed. Then also, kids who are in daycare are also more at risk of catching rotavirus diarrhea and other viral diarrhea compared to those who are not in daycare. And those same kids attending daycare are usually not or less breastfed, unfortunately, compared to those who are not in daycare, making kids attending daycare even more likely to have a more severe course of diarrhea compared to those who are breastfed and not attending daycare. And so, rotavirus vaccination is indeed particularly important for those kids attending daycare. Regarding vaccines against diarrhea, let us just mention here another vaccine against the severe diarrhea known as cholera, and that is recommended only in cholera endemic areas. I've just mentioned breastfeeding, and indeed breastfeeding is considered worldwide as a way to decrease the chance of a severe infection, meaning that breastfeeding lowers the chance of ending up admitted in the hospital, particularly in case of diarrhea. Diarrhea is actually the important reason why the WHO recommends exclusive breastfeeding until 6 months of age, to be continued until the age of 2 years. Indeed, especially in resource-limited settings, breastfeeding provides a safe and adequate food for the young infant, reducing the risk of malnutrition and contamination by viruses, bacteria and parasites. Hand washing. Hand washing regularly with soap and water, especially after changing diaper and a passage to the toilet. Hand washing after contact with blood, nasal discharge and other bodily fluids. Hand washing before and after the meals will every time decrease the risk of passing germs to the environment and contaminating food. Usually, alcohol solution for washing hands adds a bit of cleanliness, and it is okay on hands that are not visibly soiled. Otherwise, we should first wash them with soap and water. Note that before washing hands, one should ideally remove rings and jewelry. Remember also that hand washing regularly also applies to kids, and that their nails should be kept short. Finally, regarding hands hygiene, one should also refrain, if possible, from preparing food for others when we have diarrhea or an infected wound on the hands. Water. Water used for preparing food should be free of germs, and so should be boiled for more than 5 minutes when used for preparing food or for drinking, if water cleanliness, that is not assured, of course. Tools, materials used to prepare food, pots, dishes, bowls and cutlery should be clean. Finally, food itself may contain harmful bacteria and parasites, and so food should be stored in a cool place to minimize overgrowth of germs. Food should also be used by the best before date, and that is because some harmful bacteria can actually slowly grow on food even under ideal cool storage condition. Veggies and fruits. Vegetables and fruits actually should always be washed before consumption, even if they are eventually cooked and even if the package states that it has been washed already. Meat and poultry. Raw meat should usually be considered dirty as a rule and should be handled accordingly, meaning it should be cut on a separate cutting board with separate cutlery, separate tools from the one used for other food. Or these tools should be cleaned afterward if used on a food ready to eat. Meat should also be cooked thoroughly. Chicken, I just mentioned, in particular, commonly harbor harmful bacteria. So remember to be extra careful with poultry. By the way, eggs are laid by hands, and care should then be taken to cook eggs well, as they, like chicken, commonly harbor bacteria, notably Salmonella. One should also avoid leaving raw eggs, by the way, cracked open and then mixed together at room temperature. We should also be careful to refrigerate eggs well. It is actually better to simply prepare them just before consumption. A word on food ready to eat. Food that is ready to be eaten without further cooking or only after a slight rewarming should be stored in clean containers in a cool place. And that is without mixing with container, cutting boards and tools that have been in contact with raw food needing further preparation or further cleaning before consumption. Last, I was about to forget the importance of having clean and dry dishcloths, because it is also a possible source of contamination. Now, before saying goodbye after this long video, it is important to be aware of some food that are known to be risky, either naturally or through food processing, although this is not an exhaustive list. I have already mentioned eggs. The presence of Salmonella is the main risk for that. Milk product. Milk and milk product should be pasteurized and not eaten raw. unless, that is, if they go through equivalent safe processing guaranteeing then that they are free from harmful germs, notably E. coli and Campylobacter. Oysters and mussels can also contain norovirus and hepatitis A virus. The problem of food contamination during processing. Actually, food contamination can also happen as the food is processed by the industry or in a restaurant, for example. Norovirus, for example, has been found in frozen raspberries. Salmonella has been found also in bean sprouts and other processed food, including recently in some chocolate in Belgium, due to a problem at the processing factories and contamination of the buttermilk tank. That outbreak led to 453 confirmed Salmonella infection across the world as of July 2022. And by the way, this type of food processing related outbreaks affecting many people around the world has unfortunately become a common cause of infection in connection with food nowadays. Finally, note also that some dry or preserved food can also contain bacterial and mold toxins, like for example the botulinic toxin or the aflatoxin. These are not cause of diarrhea, but I wanted to mention them here as they can cause very serious illnesses indeed, and being aware of their existence is a good thing. Okay, I think we have covered finally the topic of diarrhea in what is definitely a long video. Thank you for watching, and as usual, I hope it was helpful. Please consider giving a like and subscribing if you think you have learned something. See you next time. Ciao.